Good morning, I'm Julie Mooney, the District Director of Nursing and Midwifery, and today we're in Cooma and we're preparing for the celebration of International Nurses Day next week, the 12th of May. So this morning I'm speaking to a number of our nurse practitioners about their role in the nursing workforce in our wonderful Southern District. First question today is for Linda Gill, who is a nurse practitioner for chronic and complex care specialising in respiratory. Linda, what is a nurse practitioner?
Hi Julie. So a nurse practitioner is an advanced practice nurse who has done additional studies and clinical practice in order to work at that advanced practice level. So that involves a master's degree, specific master's degree to become a nurse practitioner, which has an academic component and a clinical component. So as a nurse practitioner, I'm able to diagnose diseases, conditions, and that would involve maybe ordering some diagnostics and also able to prescribe medications within a scope of practice. So nurse practitioners have a specific scope of practice that they work within and within their specialty.
Thank you. My question, Lauren, is why did you become a nurse practitioner?
I became a nurse practitioner because I could really see a need. There was a gap for older people, and I thought that a nurse practitioner would be able to fill some of that gap. I also thought it would be good to enhance my scope of practice, and it was also a challenge as well, really just to be able to affect change for older people, whether it be in community care or in the acute care setting. So the gap that I noticed was that older people often have complex care needs. They're seeing lots of different specialists, and often those specialists are out of area, so it becomes very difficult to manage all their needs and their medical needs. So a nurse practitioner can often enhance that by really having a holistic look at the needs of that person and having that communication with their GP as well.
Bronwyn Ratz is our nurse practitioner for palliative care, and I guess my question, Bronwyn, is what advice would you have for somebody, an up-and-coming nurse or perhaps someone who's worked for a number of years to take on the role of a nurse practitioner?
I guess my advice would be to really be passionate about the area that you'd like to move into as a nurse practitioner. To have started your studies early in that field, not wait for a nurse practitioner role to evolve, to actually manifest that role in that, start your studies, start working toward that role, and to surround yourself by people who are already passionate about that role. Start creating and seeking your mentors and your support network around you, and just immerse yourself into that specialist field and already start being that person that you wish to evolve into.
So Bronwyn, if you're going to give some advice to a young person, maybe still in high school, about what would the advantages be of taking on a nursing career and including the nurse practitioner role?
I think taking on a career in nursing offers so much scope today. So a career in nursing can lead you along many pathways, and so you can advance yourself along an exceptionally advanced clinical pathway toward a nurse practitioner, which opens up a huge scope of practice into a specialist role as a nurse practitioner in a variety of fields. And not only that, you can work in community, you can work in private practice, you can work within the hospital setting as well. And because many people think about advancing in nursing along an administrative role or in a management role, but nursing now, you can evolve in this clinical role.
Caroline Cook is a nurse practitioner for diabetes, and Caroline, my question is, so how do you see the nurse practitioner role add to the nursing workforce in general?
I think the nurse practitioner role is crucial in any nursing workforce. I think having people working at an advanced practice level within a variety of specialties provides such value to the workforce. It provides that clinical leadership and support for other clinicians, both within an organisation and externally. That includes other nurses, pharmacists, doctors, other allied health professionals. The nurse practitioner also can provide a level of governance as well as advocacy and role modelling for the nursing profession. There's also a level of there's also quite a large gap that the nurse practitioner role can fill, especially in our rural and regional areas where we don't have we don't have such great access to specialty services. So not only is it a geographical gap that the nurse practitioner role can fill, but also often a financial gap. So in terms of access, the role is really valuable within these rural and regional areas.
Thank you, Caroline.